Great to have you join us this afternoon. Now, we begin in Parliament, where the minority is demanding answers from government on who frontline COVID-19 healthcare workers are benefiting from the 50% extra allowance are, as they allege BNI officers have been included in that list. Now, Parliament today approved tax waivers to the tune of 174 million Ghana cedis for healthcare personnel. A report of the Finance Committee said 21.6 million Ghana cedis has been spent on additional allowances for the healthcare personnel for April, May and June 2020. Kumungo MP Ras Mubarak claims the list of frontline healthcare workers is unfair.
It's important that this House is told who has been captured as far as the list of beneficiaries are concerned. It is very important that we know exactly which category of employees. For instance, in the committee has given a report. There is no list of who constitutes those who would be benefiting from this. Basically, supporting people who are working in critical areas is very important, but it must not be shrouded under the cloth of secrecy as it is. And I would want to inquire from the chairman of the committee whether, for instance, the Bureau of the National Investigation is included in the list of those who would be benefiting. If they are included, Mr. Speaker, what happens to others who are equally providing critical services? You cannot submit a report like this to the Parliament of Ghana without letting the House know exactly who are benefiting from these. And we know that there are many workers in the health sector who have also agitated that they've included in the list of those who will be benefiting from these incentives, who are not included. So how do you ignore some section of persons working in the area of health and then include the Bureau of National Investigation, Mr. Speaker? These are things that I hope that the committee would provide clarity for.
Now, Vice Chairman of Parliament's Health Committee, Dr. Ayuwe says there's been a difficulty defining who constitutes frontline health personnel, but that has been addressed now.
Mr. Speaker, previously we had thought that they were going to focus entirely on health workers. But in the committee meeting, we realized that there has been some interagency collaboration, and for that matter, we have broadly increased the persons who the definition initially was so limited to as health workers, which means that there will be immigration officers and other state agencies who have now been captured into the definition of who a frontline health worker is. And it is revealing that for the 2 months April and 2 months of successively April, May, June, it was 6,091, and then also in the ensuing month in May, it was 7,418, and then in June it was 7,196. So clearly shows that the numbers have been changing. We could suggest that other agencies has been coming on board as they identify them.
Let's go back to Parliament. Joseph Opoku-Gakpo has joined us live. Joseph, give us details on the tax waivers that are being applied for frontline health work. Right, Joseph Opoku-Gakpo is our man in Parliament, and he'll join us shortly.
Daniel, just to go through the details for you, this is a tax waiver to the tune of 174 million Ghana cedis. Specifically, not half, but 168 million cedis of that is actually amount that's going into the personal emolument in terms of the tax waiver on that, and then an additional amount of 5.713 million is actually taxes on the additional allowances that the healthcare workers will be getting. All of that totaling the 174 million that they will go into that particular move. Now, just to give you some additional details, this report of Parliament Finance Committee has also been giving us the general details on what we can expect in terms of how much government is spending on the said basic allowance for various healthcare persons. So we are expecting that for the month of April, May, June, the additional allowances that are being paid to the healthcare workers, the April amount is 6.5 million Ghana cedis, another 7.5 million for the month of May, and then for the month of June, it will be an amount of 7.6 million Ghana cedis. And so those will be the figures. As far as the money that's going to frontline health workers is concerned. Now, just for clarity on this, we know that the president's announcement was that for the general tax waivers is going to all healthcare persons, but those who are frontline workers will be getting an additional amount of 50% on their basic salaries, which is actually what is amounting to the figures that I just shared with you. From the committee's report, we gather that for the month of April, about 6,091 healthcare workers are described as frontline and will benefit from this. For the month of May, there are 7,418, and also for the month of June, then there are 7,196. But the claim that the Kumungu MB Ras Mubarak is making is that security persons are on this list, and he is not happy about that because some of the healthcare people are not benefiting. He's joining us for a quick conversation. Many thanks for joining us, Honorable Mubarak. Pleasure. So where are these details you are alluding to coming from, that BNI personnel are on the list of frontline healthcare persons who are benefiting from this additional allowances as far as COVID-19 is concerned? Well,
it is a fact that they intend supporting. First of all, let me say that it's exciting to see that healthcare workers or health personnel are getting some form of support in respect of incentives to help them do a good job in fighting the COVID-19 pandemic. But sadly, we are beginning to see a trend where some category of other workers who have literally nothing to do, who cannot be classified as health workers, are considered to be given incentive. And I think it would raise a lot of labor issues for us in the country, and we seriously don't need that at the moment. If you look at the staff of the Controller and Accountant General's Department, for instance, they work day and night to get things going, to make sure that frontline health workers get paid. Unfortunately, they haven't been considered. And we have instances where the Bureau for National Investigation or officers of the Bureau for National Investigation are included. And that is why I raised it on the floor of Parliament that, this Parliament of Ghana is a house of records. If the government intends to incentivize some category of security personnel, it shouldn't be shrouded in secrecy. Unfortunately, and rather sadly, that is what we are seeing. You would expect that even when the committee report came to the floor of the House, they would have listed, for instance, maybe doctors, nurses, pharmacists, cleaners, and so on, so that the Ghanaian public would know exactly who is encapsulated in the list of beneficiaries. As we speak, there are many frontline health workers who have not even received their emoluments, their incentives yet. And we are faced with an instance where they are beginning to consider paying Bureau of National Investigation workers. And you ask yourself, what have they got to do with this? Because I know for a fact, from my checks, that the BNI takes data from hospitals, but it's usually once in a week. They will probably call the hospital to get the data. Some of them don't even, visit these health centers to ascertain what is exactly happening on the ground. So it's not right, and it's not fair for the millions of workers, the hundreds of thousands of workers up and down the country who are equally providing essential service, doing their best, putting their shoulders to the wheel, and all of these workers, have tightened their belt. If we are in difficulty, and government is saying that we need to incentivize health workers because of the role they are playing, you would expect that such assistance would go strictly to health workers. But insofar as they want to open the floodgates and begin to give the BNI, incentives for literally little or no work done, they might as well consider staff of the Ministry of Local Government. At the local level, they are doing a lot. They might as well consider staff of the Accountant General's Department. They might as well even consider journalists and incentivize, give incentives for the service you're giving to Mother Ghana.
My final question will be, and I'm quoting from the committee's report directly, it says, as to who constituted frontline personnel, the committee was informed that there has been a challenge in defining who a frontline healthcare worker is, but in collaboration with the relevant agencies, a working definition of frontline health person has been accepted, and that the personnel were said to be those who are working in the most critical and risky areas in the fight against the COVID-19 pandemic. Couldn't it be that these security persons are actually within that range, which is why they also deserve to be on the list?
Is it not disgraceful that we are putting BNI officials who could be playing no more important a role than staff of the Controller and Accountants General's Department, who could be playing no more important a role than staff of the Ministry of Local Governments, who could be playing no more important a role than parliamentary service staff, not receiving anything, and yet the BNI is being considered for it. And to see that it's even been shrouded in secrecy, struggling to define who frontline health workers are.
We are told the others have accepted this. Presumably, they collaborated with the health institutions and the healthcare worker groups in coming to a decision on this, because the report says, in collaboration with the relevant agencies, that working definition has been accepted, and that's what they are working with. You're doubting that probably the healthcare workers are in on this?
This should not be acceptable by the Ghanaian public. We want full accountability. We want full disclosure on who is in on this, on who is getting what. You know, from these incentives that are meant, look at the committee's report, to health workers. So one would assume that it would even include non-essential staff of various hospitals up and down the country, which is great, But to include the BNI, excluding staff of the Controller and Accountant General's Department, excluding staff of the Ministry of Local Government, you wonder, you ask yourself what is really happening. And it is for this that we ask that the government should come clean on this and give the Ghanaian public full disclosure on who's getting what.
Many thanks for joining us. Ras Mubarak is the Member of Parliament for the Kumu constituency, joining us with those details there. And I will thank very much for joining us. And to Daniel, those have been the development. For those on the majority side, they think the move will help incentivize healthcare workers to be able to do more as far as the fight against COVID-19 is concerned.
Thank you very much, Joseph Opoku-Gakpo, for that update from Parliament. Now,